My name is Matt Hart. I work for Washington County Ambulance District. We're about an hour south of St. Louis. We currently cover Washington and Reynolds County full-time for ambulance coverage. And then we also have Mineral Area College that we provide education for all forms of EMS education, paramedic, EMT, community paramedicine, and community health worker. Whenever we started getting heavily involved in mobile integrated healthcare, we start talking about having to do things like telehealth, where we're bringing platforms into people's residence that probably don't have internet connection, more of the underserved population, where we have to provide those resources to get them the care that they need. So as we started building out our mobile integrated healthcare vehicles, we wanted to make sure that we put a solution in where no matter where they were located for these appointments, that we would be able to get them in contact with the physician, their primary care physician, for normal appointments. And also not just the telehealth, but then all of the data that goes with it. So our paramedic providers can be doing assessments with vital signs and things that are also transmitted live to the physician so they can see as well. So obviously we needed to have a solution where we have connectivity to be able to do quite a bit at these houses. Where we're located, it's sparse coverage on cellular, so we do have overlap of different carriers, but if you just pick one carrier, we a lot of times don't have service in our full coverage area. So again, our major challenge is just having a connectivity source in these super rural areas. We went with the Semtech XR90 for our solution. Currently, we have those devices in our MIH cars, so they can provide those telehealth calls, and they can communicate back to any of the primary care physicians or their offices to make sure that we are providing the best possible healthcare solution for the patient possible. Temperature monitoring was another extremely important thing for us. So we have refrigerators in all of our vehicles, and we have to be able to monitor the temperatures of those constantly. And we can't do that without a solution for getting that information back to us at our headquarters building. So we are using Verizon and AT&T FirstNet to try to get as much of the service as we can. We had to take it a little bit further for our Reynolds County coverage area. A lot of the portions of that county there isn't cell service at all. Obviously, having this device in our vehicle with external antennas on top of the vehicle, we get a little bit more than kind of what we're used to with just devices and things. But we took it a step further and added a satellite to the top of the vehicle as well. And that was able to be integrated directly into this device to make sure that we had coverage wherever we went, no matter what. Briefly, we talked about some of the other options that were out there, but with wanting to integrate the Kymeta system, the satellite, it had the best options for making that the failover and a seamless and smooth interaction for our providers. Public Safety Solutions made it very easy to implement. It was very much just a plug-and-play type situation. So they did the complete install in our vehicle before it was delivered to us. And then it was pretty well ready to go once we received it, and we were able to start utilizing it. There's no reason that for the people who cannot make it to a doctor's appointment or to whatever they need to get the medical care that they need, whatever barrier is in the way, there's no reason that we shouldn't be able to overcome that and bring it to them today. And that's what we're doing with MIH, is making sure that we can get a provider hands on the patient in their home, in their setting, and getting rid of any barrier that comes in between. And again, connectivity and an internet solution is imperative to those operations.